I'm very, very delighted to welcome Samantha back. As a burnout coach for over 10 years, Samantha began her career as a psychology practitioner in a world-leading clinic, helping hundreds of patients to recover from chronic fatigue syndrome. Over the last 5 years, she has continued to work with clients to conquer their stress and enhance their well-being, both one-to-one and within corporate organisations. Samantha believes the route to lasting change is to work with the mind and body together. Due to her own journey with chronic Lyme disease, Samantha understands firsthand the inner healing and holistic approach needed. So thank you so much, Samantha, for joining us here today, and I will hand over to you to kick us off.
Thank you, Morgan May. I'm very excited to be here again. Thank you for inviting me back, and I'm looking forward to really talking about healing your way. So how you can design a supportive lifestyle without relying on motivation. What we're going to cover today, so I am going to briefly share my story, and then maybe some of you, obviously, if you're on my last session, you'll have heard it, but actually there's a lot of new faces. And I share it just to give you, as you know, I also suffered from chronic Lyme disease. So everything I shared today is, yes, coming from a professional and clinical perspective, but also from lived experience. And then we're going to look at really what a healing lifestyle is, actually the myth about motivation and really why it isn't something that we can rely on when it comes to chronic Lyme disease, how we can replace control with connection, and then also really how we look at our capacity-based healing. And ultimately with all of this, what we're going to be looking at today is really how we work with our own bodies moment to moment, and maybe move through some of the patterns that might actually be keeping in cycles of stuckness. So just to start with my story, and I'm going to try and condense decades of ill health into just a few minutes, because really this session is not about me. But as Morgan May mentioned, I suffered with chronic Lyme disease. So I lived with Lyme disease and co-infections for about 25 years before I was diagnosed. I was bitten by a tick when I was 8 on holiday in Florida. It was in my belly button. My parents removed it. They took me to the doctor when I returned. And it was the typical no rash, no flu-like symptoms, she's fine. And I think as a family, we just forgot about it. And a couple of years later, I did experience what I was diagnosed as juvenile arthritis, but basically it was radiating, migrating pain. It came out of the blue. I had about 5 days in hospital. Then I was home and I was fine. I think the lasting effect was I could no longer do the splits. I wasn't quite as flexible, but there was no real lasting damage. And obviously now knowing about Lyme disease, of course, that is a very common symptom. But at the time, we didn't really piece it together. And then after that, I was pretty well, to be honest. Again, I could ride my bike, but what we've in hindsight realized was hills were really difficult. So I had issues with my knee joint. So there was stuff starting to surface, but rest of primary school, teenage years, like I was very, very sporty. I played sports at quite a high level. I had a very busy life. And it was around probably the age of 14 where some symptoms started kicking in. I know the fatigue definitely started then. I used to have to kind of come home from school after doing school, sport, and have like a nap before doing homework. But it wasn't actually until I entered the world of work where I guess maybe there was greater demands. Like later teenage years, I started to have flu-like symptoms, swollen glands, but the doctors were always like, oh great, tests are clear, your glands aren't too big, which obviously, of course, you think would be brilliant. Okay, there's nothing wrong with me. But the problem was I didn't feel great. And it got to the point where I kind of stopped sharing how I was feeling, because I thought I can't be feeling unwell every single day, but constantly having tests and people telling me that I'm fine. And it sort of did the usual university lifestyle. And as I said, it wasn't really until I entered the world of work that I noticed a very kind of relapsing and remitting cycle. So every sort of 3 months, I would get what I thought was a virus, have a week off work, kind of go back, but never really feel right. And eventually, when I was living in London, working quite a stressful PR job, I was diagnosed with ME, chronic fatigue syndrome, because I had again what I thought was a virus. But a month later of not getting out of bed, I finally went to the doctor and they said, you've got ME, that's about all we can do with you. So after that followed many, many years of really trying to focus on an illness that I thought I had and trying to recover. And I had glimpses, I had things that I tried that helped a little bit, but nothing really shifted. But I was functional, and to the outside world, I lived a normal life. I probably looked fine, but everything was a struggle and I didn't ever feel well. And I'm sure some of you will probably relate to that. And across that time, again, it was moments of being bedbound. So maybe a few months at a time, but then I'd pick back up and get back into work. So there was a real lack of consistency, both in my health, but also in my life. So my career was very stop-start. I kept trying to desperately live the London life until I eventually realized that the fast pace obviously wasn't supporting my body. And then in 2013, after really quite a big dip in my health, I was living with my now husband at the time, and to the point where he was having to lift me out of the bath. I had to sit to dry my hair. I was not in a great place. It was my mum actually that found an integrative health clinic based in London. And whilst that was the first time I actually came across both the functional medicine side, so I guess the physical aspect, which is what I'd really been focusing on for a long time, but they also had a psychology department. Now, I had resisted anything to do with the psychology side for my healing for years because there was a lot of stigma around ME. There is, I think, just generally around chronic illness. And I had this fear that, well, if there's anything that I can work with internally with my body or my mind that helps me, then everyone's going to think it's all in my head. But actually what I realized was, as well as recognizing physical things that were going on with my body and that wasn't working properly, I also, for the first time, recognized that my nervous system was very dysregulated, that I had unhelpful patterns. I was a real people pleaser. I was a real high achiever and constantly pushing myself and living in a world of stress. And actually coming across this clinic was the first time that I actually learned to connect with and listen to my body. And that's something we're going to be looking at in today's topic, really how we can build that relationship between our mind and body. And alongside healing, I actually retrained and eventually was offered a job on their psychology team. So I went on to work there for 6 years, supporting others with chronic fatigue syndrome and ME. And it was whilst I was working there in 2016 that a colleague actually was diagnosed with Lyme disease. And through conversations, things just started kind of just ticking in my head. I was like, oh, I relate to a lot of this, because whilst I had been well and I was functioning and I had got better, there was still a lot of things that I hadn't been able to overcome. And looking back, I probably wasn't as well as I was acting, but I'm sure many of you will resonate with the fact that when you've been ill for a very, very long time, a lot of symptoms just become the norm. So you kind of just get used to pushing through and living with them. So it was actually in 2016, a month after getting married. So it was a wonderful wedding present that I discovered I had chronic Lyme disease. And that was when my journey of, I guess, the final puzzle piece of healing really began. And I definitely credit where I got to very much with the foundational work that I'd done on both physically, but also I learned a lot on the kind of emotional, psychological support that I had obviously trained in and learned in my own journey. And yeah, I actually ended up working with a doctor in America and finished my treatment in 2020. And over the last 6 years, I have spent time building my own therapy practice. So obviously Morven Maid already shared kind of a bit more about me professionally, but also I became a mum in 2022. So I now have a very active, demanding, sassy 3-year-old. And I would say that my health has, there's definitely been moments. I noticed some changes after becoming a mum, but where I'm at right now is probably not necessarily identifying with someone with Lyme disease, but really looking at, okay, how do I put the house back together? Because being ill for such a long time, there's a reality of the impact that has on your body. So I'm very much focusing on really understanding how to, again, those final puzzle pieces that really support my body to be where it can be in its optimal well-being. And what we're going to cover today is, it really speaks to anyone. So yes, obviously we're going to relate it to chronic Lyme disease and ill health, but a lot of the things I'm sharing, I use today as a way to continue to support myself and meet my body and meet my needs. So a healing lifestyle is really a way of relating to yourself that feels supportive, and it's flexible based on your capacity at any given moment. So we want to think about healing lifestyle. It's very responsive. Okay, so we adapt to capacity, and I'm going to talk more about what capacity looks like later on. but it is having flexibility. It's not a rigid structure. So we're really looking at being supportive. So it's allowing for our needs to be met, moment to moment, day to day, week to week. It's trusting. It's really having that trust in ourselves, in our body, that we can heal. It's regulating. So it's supporting that feeling of safety within ourselves, regardless of how our symptoms are or how we're feeling. It's having compassion, which I think is key, because that allows us to be human. It allows us to really come from a place of, recognizing that there's times that we're going to meet our needs more than others, but it's allowing for that human experience and the challenges of it all. And it's really leaning on being informative. So it's looking at symptoms as a message and a guide, and it's fluid. So it's knowing that it isn't a straight line. It's an up and down. It's a roller coaster, and it's meant to be like that. So what it isn't is it's not rigid. Okay, and I just want to just caveat that if any of you, throughout any of this, if you're thinking, oh, I'm doing these things right now, notice it with awareness, but without judgment, because I definitely, with all of the things I'm about to share that a healing lifestyle isn't in the beginning, but that's what the journey is about. We learn and we figure out ways that actually we can support ourselves in the best way possible. So it's not rigid. It isn't having strict rules, regardless of fluctuating symptoms. It isn't demanding. So it's not about pushing through. And quite often, if anything, it's usually about doing less than doing more. It's not fearful. We're not really making decisions driven by fear. It's not pressured. So we're not forcing ourselves to do things, because stress obviously hurts healing. It isn't critical. There's no room for, in a supportive healing lifestyle, there's no room for that critical voice to be, beating up on us for not doing X, Y, Z, or not having the perfect meal, or, we're not ignoring our symptoms. We're not seeing symptoms as a nuisance or something we need to fix. And finally, it's not linear. In an ideal world, the amount of times I wish I could just be like, right, I'm here at A and I want to get to B. But it doesn't work like that. So it's not the fact that it's linear. Life isn't linear. So really what we're looking at is almost having this model in mind of having that supportive approach, which is working with your body, working with your symptoms, as opposed to kind of pushing through and ignoring them and working against it. And that's what creates a healing state. That's what creates that kind of safety in the body. And of course, when we're in a healing state, that is where we can notice that our symptoms start to improve. And obviously, once we have an improvement of symptoms, that then feeds back into encouraging us to do more of the supportive approach that's helped us get there. So you can see how we can really start to create a very holistic, supportive approach. And what I mean by a healing state, some of you may be aware of this, but ultimately we've got two states we can be in the body. We can be in what we class as like a healing state or a stress state, in very kind of basic terms. And ultimately a healing state is when the body feels safe. So we can feel okay or we can not feel okay. Now, this can absolutely be challenging when we are very ill and we have lots of symptoms, but there are still ways that we can try as much as possible to feel as safe as possible, to then allow our body to be in the right state, in the right place to do the healing. And I think quite often, I know when I used to think about, healing states and everything like that, rest and digest state, I used to think, I've got to be calm, I've got to be relaxed. They absolutely play a part, like being calm, being relaxed, but there's lots of different ways that we can create a healing state. So if you've got moments of joy or happiness or trust or confidence, or if you're feeling present to the moment, or if you're having fun, all of those are putting your body in a healing state, because none of those are present if we are, what the body feels is in survival mode, faced with danger. We're not interested in having joy. We're interested in, escaping, fleeing, or fighting for our life. If we think about the mechanism designed, back in caveman days, So the reason why I share this is because as we start to think about that supportive approach, that healing lifestyle, it goes so much wider than having to be calm and relaxed all the time. And it really allows us to open up to the different options that we can be nourishing and supporting our body. And I want you to think about micro moments with all of these feelings, rather than it all of the time, because I don't think anyone feels joy all of the time, or confidence all of the time, or relaxation all of the time. But especially when we've been chronically sick, when we are chronically sick, it's kind of unrealistic to expect that we would feel that all the time, because it's hard. There's a whole mixture of emotions. But it's about noticing the glimmers and really leaning into those moments and amplifying them where we can. But there's definitely ways that we hinder our healing. And I'm going to say that I ticked all of these. So this it's very common. It's very unconscious. We often, we pick up patterns and beliefs from childhood and our ways of being in the world. And naturally, they follow us through into chronic illness. And again, I used to do a lot of these things without realizing. And it's only when I brought awareness to it, then I was able to actually work on those patterns and shift it. And again, I'm using the word like we hinder our healing, because it doesn't make healing impossible, but it probably gives us a harder job than it has to be. And the first one is really that all or nothing thinking. So I was very guilty of this. I guess it's that kind of like high achiever, you've got to do it all, and that really just high expectations. And when you think about chronic Lyme, there's a lot that goes into it. So when we're all or nothing thinking, we're thinking, I've got to do like the diet really well, and all the supplements and all the detoxing and all the relaxation methods. And we've got this whole host of stuff that is all very, very supportive, but probably not supportive trying to do it all at once, every single aspect, because what happens is it feels very overwhelming and it's not at all achievable. So what tends to happen with this pattern, and some of you may resonate with it, it's like we do a lot of stuff, but we can't keep it up, so we can't do nothing. So we sort of go into these sort of boom and bust cycles of activity and ways to support ourselves. And actually what we want to be looking at is more, how can we do little bits consistently? And that leads us into the idea of consistency is really key with healing and a supportive lifestyle, but not forced consistency. And again, as human beings, none of us feel the same every single day. And especially to the women on this call, we have hormones that fluctuate a lot throughout a month. So we are not meant to do the same things every single day. And whilst, of course, we can have like foundational stuff that we know really helps us with our health, when we're in that forced consistency, we tend to fall into the trap of just doing things because we feel like we have to do them, rather than actually leaning into, well, what does my body need today? So yes, we want to be consistently, daily supporting and meeting our needs, but the forced consistency comes when we're trying to do the same things. And sometimes that feels like kind of fitting a square peg in a round hole. We can often fall into the trap of perfectionism. So we're trying to do everything perfectly, and like the perfect diet. I was very guilty of this with my diet. Everything, like, I had to do it perfectly, I had to stick to it, and it was fear-based, and it created a lot of stress for me. And we can do it in other areas, but ultimately stress is not what puts us in that healing state, and it doesn't allow for that flexible approach, really listening to ourselves. And the same with pushing through. So I was once told, I think I still remember the person that I was working with, and they said to me, if you want to get better more quickly, you have to slow down. Because I was approaching my healing in the way that I had approached life, and it wasn't helpful and it wasn't sustainable. I was trying to push through everything. I was trying to keep going, and I was trying to, get better as quickly as possible and almost achieve at healing. And actually, that pushing through is again what stops us really being able to almost have that dance. This is what's needed when we have a chronic illness, because everything fluctuates so much. We can't be rigid, and we really need to be listening to our body as opposed to forcing ourselves to do things. And again, like ignoring our needs. So for any of you who recognize or resonate with the people pleaser, I would very much find it very hard to say no. Before I worked on this pattern, I would think about other people versus myself. So I ignored my needs. So then what I would be doing was by putting other people's needs first, I was actually creating an environment that was detrimental to my health, because I wasn't getting to listen. I wasn't resting when I needed to. I wasn't maybe doing activities that, filled me up. I was doing things based on, wanting to make other people happy rather than really thinking about myself. So again, I share these as an idea. Maybe you resonate with all of them. Maybe there's just a couple, but it's about understanding, okay, how might this pattern be hindering me? And actually when we have that awareness, we can start to really move out of that pattern and find different ways to approach our healing. And there's really 4 ingredients for healing. So there's the practical, and especially when it comes to Lyme disease, there's a lot of practical. There's supplements, there's maybe protocols if you're working with doctors or functional medicine professionals. There's detoxing. I remember at one time for me, and I was on my treatment, detoxing was like a full-time job. There was a lot to do, and all of these things really matter. There's also the physical aspect. Like, we want to be thinking about moving our body in whatever way we can with how we are, but some kind of physical element is really supportive to our overall health. There's also the emotional element, and there's kind of 2 sides to this. So it's really important that we are processing the emotions that are coming up, because there's a lot. It's really tough to deal with chronic Lyme disease. So, there can be lots of grief, sadness, anger, resentment, frustration, so many different emotions that we want to be working through. But we also want to be feeding our emotions. So, doing things that create joy or give us peace or happiness, and really thinking about that side of it. And also then the spiritual, which I think is a very big word and can mean different things to different people. And for me, it just means about kind of being connected with ourselves, maybe that feeling of being connected with a greater collective, and ultimately that sense of purpose or aliveness, which I think can very often disappear. It certainly did for me. I lost my sense of purpose for a long time being ill. But all of these 4 aspects are things that we want to be thinking about and considering as part of a healing lifestyle. And it may be that you are kind of doing elements of all 4 right now, which is amazing. It may be that actually probably the top 2 is where your focus goes a bit more. And especially, I know for myself, I very much focus on the practical and the physical initially for quite a long time. And that's kind of more focused about the doing. What do we need to do as part of our healing? But we also really want to think about, who do we need to be? And that's where the kind of emotional, spiritual aspect comes in. And that feeds into, actually, when we focus on who do we need to be to create and design that supportive healing lifestyle in a way that we want, when we're acting from that place, actually the choices we make in the practical and the physical actually change, and they feel far more aligned. So let's look at the myth of motivation, because I think naturally we can want motivation, and motivation is really helpful. It's really beneficial to have. Motivation is what drives behavior, drives action, it drives persistence. We can have extrinsic motivation, so we can obviously be motivated by external rewards, or that intrinsic motivation, so more of the internal rewards, like the feelings. But it's very challenging to rely on motivation with chronic illness, with chronic Lyme disease, because motivation is never constant anyway. It's not a constant feeling in anyone, but it is more likely to be there with stable energy. And stable energy is not something we have with chronic Lyme disease or any chronic illness. We have fluctuating energy. There are times, and sometimes really long periods, where there's barely any energy. So we don't want to be focusing on motivation, because then what we can tend to find is we end up beating ourselves up because we're not motivated to do certain things, and we get caught in quite a vicious cycle. But also there's the reality of, with chronic Lyme, we often have neuroinflammation, and that impacts our dopamine, it impacts our mood, it impacts our drive. So no wonder motivation's not showing up. And often with chronic illness, we are in more of a dysregulated nervous system. So motivation tends to arise when we're in more of that kind of sense of, I'm okay, that social engagement space, that nervous system that's in that rest and digest and everything's feeling okay, then there's a space to be motivated and think about, you know, taking action and being driven towards goals. That doesn't exist in survival mode. And then finally, the system can become protective. And this was actually something I really had to do quite a bit of work through, because being ill for so long, what I learned, especially I mentioned, like, it was very inconsistent. So I'd do things and then I'd be really poorly, and then I'd kind of pick back up enough and I'd go back into life. And it was really this dance of inconsistency. And what my nervous system kind of learned was, oh, if I do too much, if I put effort in, if I take action, then actually it impacts my health negatively. So I get fatigue crashes, or I get pain spikes, or I get flares. And so the nervous system learns, okay, effort equals danger. So actually, I'm not going to have any drive, because if I don't have the drive to do things, then maybe I can keep myself safe and I can stop that harm. So that's why we really don't want to be worried about motivation, because it isn't something we can access for all of those reasons. But instead, what we can focus on is kind of two things. And initially, like that big why. So really, again, this is going to sound probably a stupid question, but why do you want to be well? You know, probably even frustrating if I think about how I might have responded if someone first asked me that when I was really sick. It's like, well, it's obvious. Like, you know, I want to live life. But I'm going to invite you all to go deeper with it. Because yes, there'll be that initial answer, which matters. But if you can ask yourself, they kind of suggest, like, ask yourself 5 times, you know, why does it matter that I can live a normal life? Okay, and really drill down. And what that will help you get to is that real core reason that may actually be very emotional. I know it was for me, but reason why you want to get well and why this can be helpful. And look, if you can't drill down 5, that's fine. Do it as far as you think you can go. But rather than having motivation, like, there were so many times on my treatment that I did not want to take what I needed to get better. I knew they were going to make me feel poorly. I was like, I do not want to do this. But when I connected to the reason why I was doing it and what the medication would do for me and what it was doing to the end goal, it helped. Not saying that I enjoyed it, but it helped me take that action because it became about something bigger than that moment. And actually anchoring into that really big why is it's not about what pushes you through, but it's what can help you make the choices that you know your body needs in that moment that maybe you don't feel motivated to do. And then the other side of it, so obviously you've got like the bigger picture, but it's then drilling down to those micro moments, because really healing happens in the small moments, day to day, when we're meeting ourselves and we're meeting our needs. So it's really thinking about, what do I need in this moment? What's my body asking for? And when we can really look at that aspect and that area, that is what really helps us to start connecting and listening to our body, and taking action from that place. And when we're listening to our body, when we're really in connection, tuning into and asking that question, what do I need? What we're actually doing is we're replacing control with connection. So I very much lived my life, and then my initial healing journey being led by shoulds. So often, especially with chronic Lyme disease, it's scary. It feels out of our control. We feel like we've got no agency. So we try to find control. But what tends to happen is we're trying to control things that probably aren't controllable, but also aren't helpful to control. That's that rigidity that I was talking about. We try and kind of get this grasp. But actually what tends to happen is it just creates a lot more anxiety. And it means that we're being very much head driven around what we should be doing, rather than actually what is the most supportive and most helpful. And those patterns create force. They create like pushing through, ignoring our symptoms, ignoring our body, overriding things. And of course, when we're led by shoulds, have to, I must, like, just think for a second, like, how does that even feel in your body? I know when I think about that, I get like a real heaviness, quite a lot of tension. And really actually, if we can move to more of that place of alignment and embracing the journey, when I think about, what do I want to do? What would be helpful for me right now? Suddenly it feels a lot lighter. and the options are a lot more appealing. And really, when we are in those shoulds, we are in a lot of stress. And of course, that's putting our nervous system into a state where it can't really heal. So alignment, and I know sometimes that can feel a really strange word, but it's basically just listening and being guided by what feels good in that moment. And that's where real true healing is about aligning with kind of heart, body and mind, and like working together with all aspects of yourself. Because it isn't about doing X, Y, and Z. There's no real set regime. Healing is different for all of us. And like Morgan May was saying, we've all got our own individual experiences with Lyme disease. And our own healing lifestyle will be different, because what works for me might not work for someone else. And that's okay. And it's really being able to lean into that and trust that you know what's best for you. And then it's really embracing the journey and letting go of the outcome. Because again, when we try and think too much about the outcome, we tend to make decisions based on what we think will make us feel better, versus actually just going with the flow of, okay, what is going to make me feel better in this moment, and detaching from this, I guess, this fear that, I've got to get better, and so therefore I've got to do X, Y, and Z. And again, that cuts us off from really what our body is asking for. So one thing I'm going to invite you to think about right now, but also, and it's maybe something we can open up into discussions about in the Q&A, but really, what's the relationship like between your mind and body right now? If they were two people, maybe in like a friendship, is it quite collaborative? Do they both hear each other out? Are they both listening to each other? Or actually, maybe is your mind a bit of a bully? And I know my relationship was, I was very in my head. My mind was very critical of my body. It was very judgmental. It hated my body, because let's face it, my body didn't feel like a nice place to be. I just used to think, it just lets me down. It's not letting me do what I want to do. But of course, when I led by my mind, again, I was in those shoulds, I was forcing. And actually what we want to do is we want to really try and flip the dynamic. We want to have the body leading and the mind supporting. So I want to offer you some questions that you can just think about. Again, you can take a picture or you can write them down, but what does my body need right now? How can I support myself in this moment? What would feel nourishing to me right now? How would I like to feel? What can help me experience that? Because the wisdom is in the body. And yes, it doesn't feel a nice place to be when we're ill. And I absolutely understand that and resonate with it. But we need the mind, because it's asking these questions, it's answering them. But the mind's more of that support. And we really want to allow the body a place to have compassion, to have space to really communicate what it is that it needs. And that's what leads us into action that actually feels good. So this is about really that inspired action, which is very much doing things that feel intuitively right, that feel meaningful, that kind of moves us away from like obligation driven. Because again, if obligation driven is very heavy, it's like, what if we leaned into something that actually feels quite meaningful to us? That is far more likely to create those healing states than doing something because we really have to, but we really don't want to. And it's again, that nourishing aspect. And of course, embodied action is very much about taking action, but while listening to and respecting the body. So again, it's being guided by what the limits of the body in that moment, rather than the mind deciding what the body should do. At the last part now, but really looking at, okay, so we want to be tuning into our body, we want to be listening to ourselves, but what does that actually look like in reality? And I want to offer you this idea that I guess, and again, name them how it works for you, but we often tend to have, I guess, maybe 3 buckets or 3 different levels of capacity that we can be operating at when we're dealing with chronic ill health. And of course, it's slightly more nuanced, but it's starting to think about, okay, how can I begin to really notice day to day? Because again, we can really shift quite quickly, but week to week, month to month, where I'm sitting at right now. Because depending on where you are, that your healing lifestyle, what your body needs, what you need, is going to look very different. And again, this is about coming back to that consistency. It's continuing to support yourself and support your healing, but not focusing on this, doing the same thing every day. Because if you are feeling really resourced and like you at your best day, kind of this energy present, that's ultimately what green, you can either color code it with green, or you can call it resourced, or add your own words to it, whatever resonates. But that means that again, my green will look very different to someone else's green and your green. So it's really tuning into what is your best at the moment. That might not be where you want to get to, but it's what your best is right now, where you have maybe more energy present. You've kind of got less symptoms, you've got more bandwidth to do things. So you probably got maybe slightly clearer thinking. Maybe you're able to have more social connection. Now, for some of you, that could be going out and about with friends. Someone else, your green could be someone coming round for a cup of tea. That is your social connection. Then we kind of have the orange, which is the more limited. So that's kind of, I guess, thinking about it more from the basic functioning. So we can wash ourselves, we can dress, we can eat, we can do gentle movement. We've got the cognitive ability to read or do bits of work. There's productivity in there, but there's also a lot of rest that is still needed. And then, of course, red is depleted. So you might call it kind of your crash phase. And this is really about just quality rest. And I say quality because we want to have rest where the nervous system is more regulated, so it can actually pick up and heal. But it's, lying down and moving your body slightly as a stretch if it feels possible. It's warmth, it's very gentle stimulation. It's creating that feeling of safety and comfort. And it's just focusing on basic needs, and maybe even some of those basic needs being met by support from others. So I wanted you to start to think about, okay, what do my different levels look like? What are my symptoms? What shows up? What am I potentially right now, do I think I'm capable of? And I'd invite you definitely with 1 and 2. This is where we want to play around with not doing everything that we think we can. So if we've got energy, great. We don't want to use all that energy. So especially when we're in that limited capacity, we can think about, again, thinking because we often overextend what we think we can do. I'm going to do, what do I think I can do? And then I'm going to cut it down by like 50%. And maybe in your resource, it's everything you can do, but cut it down by 75. Because the body needs energy to heal and be doing all of the work inside that we can't see, that all the energy used. So we never want to be meeting our energy limits. And so what we can look at is really, okay, how do I design a support menu? And again, this could be something that we open up discussions around, but this is about creating options depending on your capacity. And I would invite you all to think about it when you're in more of the, I guess, ideally the kind of resource state. But even if you're in the limited, you might have the brain capacity to think. And it's an active list. And what this does is it reduces decision fatigue. It's ways that you can turn to things and think, oh, yeah, in that space, this is what I know really supports my body. And it's about trying different things. And what this does is it really builds that connection with what do I think I need? And I still will do this. I still think about, okay, what's going on for me today? Or like, I don't know, if I've been woken up in the night by my daughter or something and I'm feeling more tired, I'm like, okay, well, what do I need? I'm a bit more limited today. I've got certain things and I recognize as realities to life we have to meet. But around that, I'm like, okay, what's my body requiring or asking of me today? Maybe it's a slightly slower pace. Maybe it's a few more rest breaks. Maybe it's just extra hydration. So it's really thinking about that continual checking in with, where am I today? Am I resourced? Am I limited? Am I depleted? And not coming from it, checking in an anxious way, but that sense of like, let me just tune into my body and what is it asking for me right now? And obviously having choices really takes the pressure off, and it invites that curiosity to try different things versus force shoulds. And honestly, what I'm talking about here is small little things. Yes, there's the bigger stuff that goes into healing, but I don't know, watching an episode of your favorite program or reading a book or a trashy magazine or whatever it might be, like all of these things can add up throughout the day to really support you to be meeting your needs. So in summary, healing, supporting and designing that healing lifestyle that's supportive, you really want to think about sustainability. So that's why it's not about doing everything. It's thinking, okay, how can I approach this in a way that daily I can be meeting my needs. So I'm not booming and busting. I'm not kind of meeting my needs really well and doing lots of stuff one week and then just disconnecting the next week, because micro moments of meeting your needs is so much better than trying to do like massive stuff that you just can't keep up with. And it's really listening to your body and not overriding it. And then I want you to think about it, and my invitation to you, because again, I know it can feel a bit overwhelming sometimes, of like, oh, I've got all these things I need to do to get better. But how can you integrate it? So it's not another to-do list. This is about bringing these things in as part of your life. And like I said, I still view, not perfect, not every single day, but I still have that lens with my life and checking in on myself. I'm coming at from a different place, and I guess my green, orange and red look different now, but I still use that as a guide. But I'm also thinking about, okay, how can I add it on to daily things that I'm already doing? So is it, if I'm brushing my teeth, just taking a moment to kind of just ground, focus on what I'm doing, not like have my brain like already planning the next thing that I need to do. So for you as well, if you, depending on where you are in your journey with healing, like think about it as being part of life, not all this extra stuff that you have to do. Thank you very much.
Thank you so much, Samantha, for joining us. And as you probably know by now, we have some National Lottery funding for these sessions. So it's really exciting to be able to continue this project. Stay tuned on our socials and newsletters for our next sessions. We've got lots of exciting guests coming up, and hopefully we'll be welcoming Samantha back again if we can persuade you.
Yeah, thank you so much. It was lovely to come back. It's just a really wonderful space that you're creating.